All right, so my topic is congenital heart disease at JSCAI, home for congenital heart disease research guidelines and cases. So there's my disclosures. And again, I just started to look at the congenital submissions first. And this is the numbers from 2022. We're a small community, but it's a very united, collaborative, and international community. So in 2023, we went up by 7, and 2024 so far, 22 have been submitted. And if you extrapolate this to the end of the year, it's going to be 66. So it's a big jump. The acceptance rates are similar to what Alexandra shown in the adult side. Case reports, 5 in 2022, 8 in 2023, and then again, extrapolating for the full year, it'll be about 21 for 2024. I actually watched with interest David's presentations, and I noticed 2 of the 10 cases were congenital cases, and one of them was the transesophageal echo obstructing the aorta. Now, that's actually well known in the smaller pediatric sizes. And when he asked me to help him look at that, I showed him some of the older publications, but I thought that this is still worth publishing because if it's new to the adult world and you guys are doing more of this, then it's best, we better make sure everybody is aware of this complication. All right, so now again, as I said, it's a small international community, but out of all the submissions, there were 11 countries outside of the U.S. that submitted manuscripts. So that's really a nice indication of the international collaboration. We've had 6 conversations in cardiology. Now, this is the podcast that Alexandra mentioned. This was a first of its kind international pediatric congenital heart disease cath lab standards. That's never been published before, and this was truly an international effort led by Ralph Halser, first author. And we actually did a lot of work looking at how different countries did organize their cath lab. And actually, I think this is going to be a paper that's going to be referenced for the next 10 years. We've done some work on integrating CT imaging into pulmonary, into the congenital heart interventions, including PDA stenting. So this paper came out of San Diego, looking at how CT can show or at least predict how the ductus can change in morphology and anatomy depending on this cardiac cycle and how the stent might impact. That can help us make better decisions in stenting the ductus. This is another paper on looking at CT, looking at the RVOT, learning how dynamic the right ventricular outflow tract can be, especially after surgery. Of course, this is in the context of putting transcatheter valves in. And this was really a collaboration of 3 societies, SCAI, the Society of Cardiovascular Computed Tomography, and then, of course, the Congenital Heart Surgeons Society. So again, very collaborative here. This is a paper on the composite outcomes of aortic pulmonary valvuloplasty. This group looked at it, not just the outcomes, but the risks involved as well. And again, as a result of a CCISC registry. This is an international registry. This paper came from Thailand, and we had a nice conversation with one of the surgeons from Thailand, comparing a transcatheter pulmonary valve to surgical valves, and I thought that was a really good international presence for JSCAI. Healthcare disparities. Now, of course, pediatric congenital heart disease have its challenges too, and we definitely don't have the same kind of resources or support from industry or even the regulatory agency. That's improving, but this was a really nice paper that a group of the congenital people put together to discuss where the disparities and how we can overcome some of the challenges. Failing Fontan devices. Now, most of you guys are very familiar with left ventricle devices. This is really for the single ventricle where the Fontan, the right side, is a problem. And again, many of these is going to go into the adult world and get old and have failing Fontan. So you guys got to pay attention to what's going on here. Several devices being developed under investigations. And here's just an example of some of these devices that are being developed. And this is where it's actually position within the Fontan baffle itself. There's no pumping chamber there, so all the measurements, the metrics, and all that will be different. So I thought this was really interesting conversation in a podcast. The other important comprehensive review papers. Here's an example. This was the first one I've seen where Santhanandam Shyam, one of the leaders in PDA closures in premature babies, actually did a survey internationally among a bunch of countries around the globe to see how they're evolving their management of the premature babies. So just to show you some of the tables showing the improvement in survival of the premature baby, you have Europe, the US, Australia and Asia represented here. And here's just an example of how small they can go. This is a 570 grammer on an oscillating ventilator. You see the belly moving from the oscillator, and the skin is so thin that it really is a fetus, right? You see all the vessels there. And then this is what it looks like after you put the device in. You see how you actually, the pulmonary edema goes away very quickly. This is a 2-day span of x-rays. Lymphatic imaging and interventions in congenital heart disease. I'm sure some of the adult guys are going to slowly explore this arena. And basically, you see the lymphangiograms that are done and the different devices that are now available, glue, particles, even coils here to improve the lymphatic, to at least get rid of lymphatic drainages in all the different areas, especially from failing congenital heart diseases. Again, this is a whole new area. In fact, there's an emerging group of interventionists, pediatric, who call themselves the lymphomaniacs. I thought that was pretty funny. Management of pulmonary vein stenosis. All of us know that recurrent pulmonary vein stenosis can be really a fatal in the pediatric world. And Ryan Callahan, who was at Boston Children's, who's now at Children's Hospital Philadelphia, took a lead on this and wrote that up, and it was a nice summary. Of course, who can avoid ACHD interventions, right? In a group like this, we actually had this as a paper that discussed all the summarized all the different things that can be done in the ACHD world now. Valve technologies for transcatheter pulmonary valve. You guys are really familiar with aortic valve, but the pulmonary valve is another area that has gained some steam, and I'm sure that some of you guys are using some of the valves that are available, but this is a good summary of all the different technologies available. All right, we also do crazy things. Here's an example of the novel Ono retrieval device. I don't know if it's made it to your cath lab yet, but if I were you, I have one of those in my back pocket in case you embolize it, a large device. So here's it really looks like a nitinol basket that you can actually, in this case, this was the first report of taking this basket and, wrapping it around a clot and pulling it out. I know some of you are already thinking, what can I do with this in other applications, right? Like tumors? But certainly when you lose a big device, this is a bailout. Tracheobronchial stenting. I'm not sure how many of you guys have touched on this, but this is a group from San Diego that have worked with their ENT docs. Basically, here's an example of a compressed left bronchus, and they're putting a coronary stent in. Of course, this is a baby. This is just to buy the time for the baby to just survive. Now, these are not meant as long-term treatment, but palliation. They've learned that if you put the stent in for a couple of weeks, the bronchus can actually remodel, and then they'll take it out. So to me, that's a novel thought and approach, in the congenital heart world. Creating a shunt using a covered stent. So this is a baby who had lost a PDA. This is a ductal-dependent lesion. The kid's quite sick, and the authors smartly traversed the occluded segment of the PDA and implanted in a covered stent and basically saved the kid's life. Centralized, a lot of veins are lost during a lot of these interventions. So central vein rehabilitation, recannulization is something that we've all been working on over the years. You can see here's a patient where the nominative vein, SVCs are completely occluded. The patient has SVC syndrome, and we're able to open those things up. This is that area there. Also from the femorals, bilateral femoral vein, IVC occlusion that we can open up. So let me just summarize that the field of pediatric and congenital heart disease interventions is exploding with new devices and techniques and expanding rapidly across the globe. We are a small community but very integrated internationally and very collaborative. We collaborate with adult CHD guys, the congenital heart surgeons, other pediatric services, other pediatric subspecialties, and I do think that JSCAI is growing in recognition among the pediatric community nationally and internationally. Thank you.
Thank you very much. So I think between David and Frank, next year what we're going to do is have the prize, right? We're going to go through all the case reports, and we'll vote on the best one and give out the prize. I think we have a couple minutes for discussion. Structural heart disease we didn't talk about. Maybe the two of you want to talk about that and maybe some of the content on that you've reviewed.
Sure, I can jump in. Is doing something? Potentially. I think JSCAI really has a niche role in the field. there are a lot of journals out there that are publishing a lot of different papers in different areas, and JSCAI has really positioned itself very well to be sort of the operator's journal, right? This is a journal that conveys practical information for people who are going to be doing procedures, and has really made a niche for itself in that space. In the structural heart disease space, I think we've seen that all the way through from reports at the level of individual cases to trials to meta-analyses of devices in the space. So I think JSCAI has really, in a very short amount of time, positioned itself as kind of the go-to journal in that realm. I do want to add one comment about the open access nature of JSCAI, because I think that's important. Most people in this room have access to U.S. academic medical libraries, right? If there's a paper you want, you can get it. Usually you can download it electronically within a second or two, and if you can't, you can ask a medical librarian to find it for you. That's not what the world looks like. And so the fact that JSCAI is open access and is available with the click of a button to anyone, anywhere in the world, I think is fantastic, because it allows articles published in JSCAI, the operator's journal, allows articles that tell people how to do interventional cardiology to be available to people anywhere in the world, even without access to the paid subscription medical libraries that many of us use every day. So I think it's really a great testament to the whole team, and especially to Alexandra's leadership, that JSCAI has evolved in this direction and should continue to grow.
All right.
Yeah, I'll echo that. Absolutely agree with everything Andy said. It's just been really exciting to see in a short period of time the evolution of the quality of the papers that we're getting. So from 2022 onwards, it's amazing. In the structural space and also in other spaces, we went from small case series and kind of gee whiz type articles that weren't really case reports and maybe small case series to larger and larger data sets that are very meaningful, yielding actionable information, long-term performance characteristics of valves and structural heart valve deterioration and so forth. Those things, I just feel like we hit an inflection point in the last, I would say, year or so, where the quality has just skyrocketed. I'll also amplify the point that you made about the rest of the world. We've all had the good fortune of traveling outside, and particularly in Asia, it seems like there is a real appetite for getting involved in this, both from the standpoint of contributing articles as well as downloading. And so at one of the JSCAI sessions, at the ASEAN meeting, which this year was in Vietnam, there was a lot of talk about JSCAI. So it was nice. For us, every Tuesday afternoon, it feels sometimes like a little bit of an echo chamber, because we're all optimistic, we're all bullish about this, we all want to see the journal grow. But it's incredibly affirming to hear that from the other side of the world.
All right, well, thank you. I'll also mention that all the SCAI documents are published in the journal, so that's the place to go and find them.